guest, Dr. Clark McKown, a licensed clinical psychologist and associate professor of behavioral science at Rush University Medical Center. He's also the executive director of the Rush Neurobehavioral Center. He earned his PhD at the University of California, Berkeley, completed his internship at Stanford University Medical Center's Lucille Packard Children's Hospital, as well as the Children's Health Council. Quite a resume. His work focuses on the assessment and treatment of children and adolescents with social, emotional, and learning challenges. Dr. McKown is with us today to share his expertise in autism spectrum disorder, shedding some light on the myths and realities of this often misunderstood condition. Please welcome Dr. McKown.
Thank you. All right, it's great to be here, everybody. Thanks so much for having me at Whitney Young. I've driven by Whitney Young a million times and wondered about this awesome place, and so it's such a thrill to be here. And as I was standing over there, I was looking out into the audience at you guys, and you know, every once in a while, not very often, but every once in a while you have kind of a moment. And I was having a moment over there because I was realizing, looking out at you, that what I'm looking at is really the very near future. Because in not too many years, you guys are going to be in charge of everything. And it makes me actually feel great. I don't know you guys that well, you know, we just met, but I have a feeling you're fantastic people with wonderful characters, and I feel good about the way the world's going looking out in this audience. So we're going to talk a little bit about autism. I'm just the warm-up act. This guy's who you really want to hear from, but we'll talk a little bit about what autism is. And as I was preparing this discussion, I thought, well, maybe a good place to start would be with what you guys think autism is, then we can go from there. Because everybody in this room, regardless of your experience or studies, has heard the word and has some theory about what autism is. And what I want to do is get a little bit of a sense of the theories you guys hold about what autism is, and I can use that as a way to sort of gauge my comments. So would some brave soul be willing to share your idea of what autism is? In the back. Yes. As loudly as you can.
It's a social emotional disorder that causes people to have issues connecting with other people. So they don't really understand regular social interactions or emotions, and they can't recognize them, or they have trouble recognizing them in other people.
Holy cow. Do you want to take over here? That's really good. So she said it's, and I'm going to paraphrase, I didn't get all that, but it's a social emotional condition that makes it hard for people to connect with other people and, among other things, to read other people's emotions. Is that a fair? Okay, very good. What else do you guys know about autism? Yes, up here.
Usually they're smarter, like on a cognitive scale, but in that same way, the smarter they are cognitively, like the less in tune they are socially.
Okay, just to repeat so you guys can hear, that usually people with autism are smarter on a cognitive scale, but the smarter they are cognitively, the harder time they have with other people. Is that a fair summary? Okay, what else? Somebody else has a theory of autism. Just one or two more ideas. Yes?
There are many different ranges and types of autism.
Good. I appreciate that. That's great. And over here, one more. Yeah. Fantastic. So there are behaviors and rituals that people with autism sometimes have, like hand flapping or having to do things in a certain order. Okay, that's excellent. Okay, so are you guys all psychology students? Are you taking psychology right now? Raise your hand if you're in a psychology class. Okay, everybody. So you guys already know everything. Okay. So then let's talk a little bit about autism, what it is, what it isn't. So as you guys already schooled us, autism has three basic features. There are social challenges. People with autism do have difficulty reading other people and connecting interpersonally. People with autism have language challenges. Often early language development is delayed, and the kind of language that people with autism do end up developing is not as fully developed as you and I are able to communicate. What a horrible sentence that was to discuss language development. So, and as you just mentioned, people with autism often have behaviors that they need to repeat or rituals that they need to engage in over and over again, or have an area of very particular interest, like a passion for basketball, that can sometimes be used for good. And the other piece to know is that autism is really a neurodevelopmental disorder, which in my mind means that it's largely inherited. You know, there was, and we'll talk about this in Myths and Realities, but there was a time when people thought that parenting caused autism, and it doesn't. It's largely inherited. It's nobody's fault that somebody has autism. It's genetically mediated. We don't know exactly what causes autism, but we do know that it's not really about family environment or other conditions of living. So let's do a quick thought experiment just to try to get a sense of what it might be like to have autism. There are a couple of things that are true for many people with autism, not all. A lot of people with autism have a very hard time reading other people's emotions. So there are a lot of different ways that we read others' emotions automatically every single moment of the day we're interacting with others. One is, of course, their facial expressions. Faces are so communicative in the human species, and they communicate our state of mind and our emotions beautifully. So you know when your friend is happy, you know when your friend is sad, you know when your friend is scared, you know when your friend is upset or embarrassed or proud or ashamed, or all of these emotional states. You guys get it so quickly you don't even realize you're getting it, and you don't even realize you're getting it from faces. So I want you to think for a second about the last time you were in an interaction either with a peer or a family member or somebody important to you when you knew that they were feeling something really strongly. Could have been anger, could have been elation, could have been sadness. Has everybody got a moment in mind? Got a moment in mind? All right. Can you say what it was about that moment that let you know what they were feeling? Yes? Okay, you could tell by her tone of voice, right? That she was angry. Exactly. Tone of voice is a huge carrier of emotional meaning. And so imagine for a moment, okay, so imagine for a moment that you could no longer tell what somebody was feeling from their facial expressions, from their tone of voice, okay? And you're at the dinner table or with friends, and one of your friends starts to get upset about something that you're doing. You're kind of crossing a line, but you don't notice they're getting upset. You know, you can imagine how that would unfold in your world if you didn't have that ability. It would be like kind of traveling through the world really with one hand tied behind your back. Another skill that a lot of people with autism spectrum disorders don't have as well as we do is the ability to take another person's perspective. Okay, so in all kinds of interactions, especially if you guys ever teased somebody else in an affectionate way, like in a friendly way, or been teased in a way that made you feel good, I bet you have, because that's just part of life, part of friendship and part of life. If you're gonna tease somebody well, if you're gonna like poke fun at them but make them feel good, you really have to know where they're coming from to tease effectively, okay? If you can't do that, you're gonna totally miss the mark and probably really make somebody angry or offend them. So anybody here who's ever been teased affectionately or has teased somebody else affectionately knows how to read another person's mind, essentially. You can take their perspectives. People with autism have a really hard time with that. So you can imagine how hard it might be if you had those challenges. So let's talk about a few myths and realities, and then we can go to the main act. So one myth about autism is that people with autism have no interest in interacting. In fact, it's not true. Most people with autism really want to have friendships, want to connect with other people, want to interact and socialize. There is a will to interact and make friends, but what's lacking is the way. You know, there's a will, but not as much of a way. So people with autism often don't know how to connect effectively, and so they get tripped up in the execution of making and keeping friends. Another myth is that people with autism, and this is kind of an older myth, but people with autism don't have any attachment to their parents. And in fact, people with autism do develop loving and close attachments to their parents. It looks different often, but when you put them through a series of situations that where, say, a caregiver leaves the room of a toddler with autism, that toddler becomes upset because their caregiver is gone. And they become relieved and seek comfort when the caregiver comes back. These are classic signs of a deep attachment between a child and a parent. The attachment looks a little different, but it's there and just as important for people with autism as for people without. There's a myth that has really been debunked, but we were just talking about what causes autism, and the fact is we don't know ultimately what causes it, but in the 60s and 70s there was a developmental psychologist named Bruno Bettelheim, and he had a theory of autism that he called the refrigerator mother theory. And his theory was that cold and withdrawn moms caused their infants and children to become autistic because they were so unloving towards their children. Really kind of a horrible theory, especially if it's wrong, right? Especially if you're a mom, it's just like blaming moms. And the fact is, it's absolutely not true. There's not a, moms, dads, parents do not cause autism. It is largely inherited. Has anybody seen the movie Rain Man or heard about that movie? Okay, there was and it's really a very interesting case. In fact, I was looking this up last night. If you ever get a chance to check out the YouTube of the guy who was Dustin Hoffman's character was based on, he's fascinating to see interviewed, and because he's a wonderful guy who's very peculiar and has these incredible talents. Like, you can ask him pretty much any fact about history and he gets it. And then, you know, something happened June 4th of 1731. You can say, what day of the week was that? And he'll tell you it was a Thursday, and he'll be right all the time. He's got these really incredible specific talents, and that's called being a savant. And very few people with autism actually have that. Some do, but very few do. So the Rain Man syndrome is unusual. In fact, there's a misconception often. I was glad to hear that you said that people with autism often have very high IQ, because a lot of people think that autism is associated with having low intellectual ability, but it's not. There's incredible variability in learning abilities in people with autism, where some people with autism have learning challenges, other people with autism are extremely bright and able to learn. But no matter what the IQ is, the social challenges are the constant and the core feature of having an autism spectrum disorder. And then I think there's a myth out there that there's nothing that can be done when a person is diagnosed with an autism spectrum disorder. And in fact, there is no cure for autism or autism spectrum disorders, but there are very, very promising ways to support the development of children, especially very young children with autism, that can really alter their developmental trajectory and get them to function much more highly later on down the road. And there's a lot of work constantly being done to improve those methods to give folks with autism a chance. And then a final myth is that people with autism are all severely disabled. The fact is, and I was glad that you mentioned that there's a variety of autism, because in fact, the reason we call it autism spectrum disorders now is that we recognize that autism is incredibly varied. There are people who are severely disabled with autism who have no speech and who won't live independently, but there are an increasing number of people recognized as having some of the social disability, some of the language difficulties, some of the peculiar the special interests of autism, but they're much higher functioning. They are able to go on and live independently. They might have challenges, but their level of disability is much less severe than we commonly conceptualize. And I guess what I'd like to leave you with is the idea that, as with any difference, learning difference or any other kind of difference, we have more in common with people with autism than we have differences. And one of our challenges, I think, as people, I think Jim's gonna, just did such a lovely job with his basketball player, is to go beyond the diagnosis and recognize the individual with autism. If you have a chance to interact with, work with, learn from a person with autism, make an extra effort to say, hey, I want to understand who this person is, what their interests are, what their talents are, what they're good at, what they're not good at, what makes them happy. Because just like any group of people, there is a huge variety of personalities, interests, talents, and passions among the community of people with autism spectrum disorders. And it's a natural human instinct to say, hey, I know what autism is, so I know what this person's all about, because we want to simplify the world. But go beyond that and really try to get to know that person if you have an opportunity. Okay, so I'm going to hand it over to the main act. Thank you so much for your attention. I hope you learned a little bit, and really appreciate the program. Okay?